Alex Jahangir joins us now, head of the Nashville Coronavirus Task Force. And good to see you, Dr. Alex. Thank you very much for coming on. And what role will not only you, but other, folks in similar positions to you, local task force, play in all of this once you get the recommendations from the CDC? How do you anticipate it working?
Sure. Well, thank you for having me. Here in Tennessee, the state of Tennessee has been coordinating actually for several months with municipalities such as Nashville. And what we were going to do here in Nashville is the state will get the allotment of tests of vaccines. We'll provide those to health systems for the people that the primary healthcare workers and so forth. But then the city will then work, and the public health department of the city will work to provide those to first responders, to the staff of the nursing homes, and perhaps to school nurses. And so we will have a very active role both as a municipality as well as the health systems in our city to make sure that this vaccine is distributed quickly and in a manner consistent with what is being recommended.
How do you feel about, and we'll hear probably later this hour exactly what the CDC group says about it, but the order things should happen. The frontline healthcare workers being at the front of the line certainly seems to make sense to just about anybody who's been asked about this. But then to the point Blake was making a moment ago, there seems to be some debate after that about the so-called 1A group. Do you take people who are in long-term care facilities, nursing homes and other facilities, which I think is about 3 million people around the country, you bump them up ahead of some other folks, or do they get at the same time as the healthcare workers? I mean, how do you think that 1 or 1A phase of this should work out? What makes the most sense to you?
So I think, as you said, the healthcare workers makes a lot of sense, right? I mean, the problem with hospital capacity right now is not necessarily physical space, it's staff. When it comes to nursing home question, I think you have to look at, obviously you want to preserve people's life. That older people are more likely to get it and have worse outcomes. But most of the people in nursing homes will stay in nursing homes. The way the virus gets into nursing homes is the staff that comes in and out of those nursing homes. So it may make sense to vaccinate those individuals first to try to minimize the transmission of people coming in that gives it to nursing homes. And then maybe from there, if there's enough vaccine, to give it to the higher risk patients or individuals in nursing homes. But you got to remember, there's only so much vaccine on the front end here in the next month or two that'll be available, that we have to be very careful and judicious as we move forward.
Right. I don't know if this is too in the weeds for your level of expertise at this point in terms of what you've been told or what you know, but I guess it's like 21 million healthcare workers from what I read and 3 million in long-term care. So that's 24 million. And I guess I would attach only to that because some of the other groups we're talking about are much larger. For example, the total number of senior citizens in the whole country is well over 50 million. Total number of essential workers, which is a much larger group than just healthcare, is like 87 million. So if we could get that 24 million first, we'd be off to a pretty good and sensible start, right?
Yeah, I think so. Especially, again, I want to the healthcare worker part of it. I mean, I'm a practicing surgeon right now. The healthcare worker part of it, I think, is so critical because, again, our biggest worry in our city and I think around this country is running out of people who can take care of all healthcare needs in our facility. So if you the nurses, the techs, the doctors, then I think the flattening the curve argument and statement that we've been making for the past 9 months happens right off the bat, right? We flatten the curve because healthcare workers are not getting sick anymore, and we have capacity. And then I think subsequently, like you're saying, my hope is that in the next 6 to 9 months there'll be that hundreds of millions of doses of vaccines so that the essential workers, teachers, a lot of people who I think are essential to making our economy and our communities work that need to get this vaccine. But start with healthcare workers, have the high risk older people, and then go from there.
And we get to sort of normalcy, which I've been asking a lot of people over the last couple of weeks, say June 2021. Is that realistic? Before, after? What's your best sense?
People ask me that question a lot, and I often tell people second or third quarter is critical. But here's another thing, if I may add, is having the number of vaccines available is important, but we need to make sure we as a society get that vaccine, right? The vaccine appears to be very effective, almost the same as measles and mumps, but the only reason measles and mumps went away is because people were being vaccinated. And so I think if we get everyone vaccinated and we do it in the way that it's proposed, yeah, I think second quarter, end of second quarter, sounds like a good time for a lot of our society to be vaccinated.
Well, the news is promising, and it's promising that we're actually talking about timeline rather than whether we will have a vaccine, because we know that the tests have been going so well on that front. Thank you, Doctor. We appreciate it. Dr. Alex Jahangir there in Nashville.